any of our panelists would be great at this time. I think they've engaged in a lot of participatory methods, so we would like to advance the conversation and engage in more dialogue with you. Questions from the floor?
I have a question for Yesenia on this more around process. So how is it that you come up with these? Because I know that in popular education you try to hear what folks have in the room, and so who develops these challenges? Is that done collectively, or is that done from the facilitator, and then from there you draw on other challenges?
Yeah, it's a combination of everybody in the room and support of data that we have, existing data that we already have. And most of the time with the communities that we're working with, we have a lot of missing data. But really it's working with the groups that we already have and using this equity and empowerment lens tool and asking those questions under process are very important. So I'd encourage you to look at that.
I am Ann DeBiase with the Trust for America's Health, and I'm curious how you all know when you've succeeded in really engaging the community.
I can go first. That's a good question, and I think we had a lot of conversations today around, metrics and indicators, and sometimes whether it is or isn't appropriate. So, I mean, I think there's some of these larger areas where you've seen part of our vision succeed or part of our vision be completed, so that in itself feels like a success. So based on, this community plan, X was completed. But I think in terms of other kinds of community engagement, I think the biggest thing, and this isn't really something you can measure, but is that trust I mentioned earlier. So I guess, but when you feel like you can be invited to the table to work on specific initiatives from people in the community, that's one form of success.
And I would just echo what Stephanie said. And the safe space is so important. I think I'm thinking of a situation recently where the meeting was held really far away from where most people lived, and it was kind of in the city, and there's parking issues. So always kind of recognizing where you're at and where people are at too, and being respectful of that and asking questions. Like when you really don't know, you don't know. So ask, and don't be afraid to ask, and just offer yourself like that, like, I don't know, I don't even know what to call this. Is it Native American? Is it Indian? Like what do you want?
I think the definition for success in my community is when I see leadership from within the community elevated, when I start going into spaces and seeing faces that generally were excluded, and now the environments are changing. I think that's success.
Hi, good afternoon. Thank you for all your presentations and for hitting on nuances that are challenging within this work. My name is Shaniqua Wusu, and I'm from Change Lab Solutions. My question is, and it could be for any of you, how do you mitigate or address when the community is fatigued by doing this work? Because ultimately, I would think that all of your projects are about the long game. And so how do you keep folks engaged and then pull in those who tend to fall in through the cracks or not engaged at all?
Well, just in terms of more conventional community planning fatigue, we definitely have a lot of that in our area, and that's why, just in terms of, I guess, community engagement methods, we try to avoid doing meetings as much as possible. We really try to meet people where they're at, so if we are going to be trying to get community feedback about certain things, even though that might be one option, we also go to the grocery store, ask questions there, get community street teams involved to go door to door and ask people that way. And so I think for us, it's just making sure to have different forms of engaging people. But again, there's definitely still fatigue kind of in the long run when you see there's just so much that we want to do in the community, and where do we start? So I don't really have a great question or a great answer for that.
And I would add that I think, well, for my work specifically, when people are coming, that's why it's so important that they're also a part of the agenda and they're building that agenda. Because if it's only the things that I'm interested in, of course people are going to be fatigued and they're not going to want to be there and they're not going to want to participate. So having those conversations with community members that are, being affected by whatever issue you're talking about, it's very important to really pull them in and talk about what do you want from this meeting. So a lot of the meetings that we've been facilitating, people have asked us, can you have a nutritionist this time there? So it's mutual. Like, we're building the agenda together and we're making sure that people are there. When people are not showing up, you really have to step back and ask questions about, why is this happening? Where are we not respecting our community? Because there's something for sure that somebody is not doing right when people aren't showing up. And I think that's a huge indicator for us. When people are coming and people are staying after the meeting is over, we're like, okay, it's time to go. Like, we need, us paid staff are like, okay. But it's good. It's telling us that people want to be there. And just a perfect example was the funding stream for the coalition that I'm managing. We just got an additional funding for another year, and I was telling the community members of our group, guess what, guys, like, we're going to keep doing this. We just got additional funding. And one of our members stood up and he said, you know what, it's not about that though. Like, we're here and we value so much what's going on that I'm sure we could all pitch in $5, right, guys? Like, we can all help each other. And that was so powerful to hear it from one of the community members that's been coming to say, no, we want to keep coming. And regardless of funding, we're going to make it happen and we're going to find the space. And you guys are a nonprofit, so just check the room out for us. And, just having those conversations, I think and you can feel it.
And I'll give it to Shelton. I think they mentioned in their panel a little bit earlier, a little more indirectly, having those early wins, those small wins, as well as the large wins. So a lot of times when we delay the win to the end, the big win, then that can cause fatigue along the way. So making sure that we're celebrating, I think you talked about celebrating those accomplishments, and then seeing what serves as reinforcers for those in the community. So when we celebrate, don't assume what the celebration is, right? Get that feedback in the ways in which we want to celebrate. And then we also they talked about too, and Yesenia just noted, making them work meaningful. And so with that, if the work's meaningful to me, an organizer that I've met years ago told me you frame it around helping people to protect their best interest. And if I have value in that, then I might get tired of going to the meetings and showing up or whatever that might be, but I know I need to protect my kids and their education. And so reframing the conversation in ways too that I can see along the way that I can't give up. It's a collective fight. I think we talked about fight earlier. That's ways to, I think, to push through the fatigue. Shelton?
You took my answer. I think also sometimes helping people to see that the effort that they're putting in, they might not see the end results of being, just a realist about that also can help people as they push through those fatigue moments.
I have a question. Do you have challenges of getting your system leaders to the table? And if so, do you find it also maybe there's obstacles of making them feel comfortable at the table just as much as your community members? And if so, do you have any tools or suggestions in how you make them feel comfortable?
So my first response is, I don't care about how they feel. I really mean that. So we have had some really good moments of bringing everybody to the table. And one of the things that we were doing, this is one of those fail forward moments. And I think the fail forward, so if you invest without proximity, that's loan sharking. But if you invest with proximity, that's accountability and equity. And we would create spaces where everybody would come in the room, the leaders, the service providers, the practitioners, the community folks, and we called them network night. And when they would come in, everybody sat at tables just like this. There was no this going on, right? So right in this setup, it looks like we have the knowledge, right? But instead, everybody sat like this and ate dinner together. So now I'm sitting across from the service provider as a community person, and we're sharing a meal together. And the leaders in the community, they're sharing a meal together. And so that changed the power dynamic and created a real awesome space that we met monthly with leaders. And So that was one of the ways that we did.
I have a question. We want to be positive, but there are those moments when you hit a major roadblock. Can you talk about how you keep community going when, I mean, like the big hammer comes down and you have to regroup, maybe go a different direction, maybe even invite some other people to the table? And what's worked and kind of what's some of the wisdom you can share from any experiences you've had?
I think in my line of work, the most recent example was just after elections. We had a meeting that was scheduled that Thursday, and our meeting was going to be, the conversation was how to meet your new elected legislators and how to write them a letter or how to set up a meeting. It was going to be this robust training on that. And we kind of had to step back and say, are people ready for that right now? Are people ready? We did not know what to do. We did not know. As staff and as people who have jobs and have different privileges, even me as a Latina, I had to recognize that I had some privileges here. We really took that step back and invited people. And when we invited people, we said, we're going to do our usual gathering with food and just talk about what happened and offer that space. And we also asked her, what do you need? And nobody knew, but we all got together and we had a space to talk about how did you feel on the most happiest day of your life? How did you feel after elections? And how do you feel today? And kind of built off of that. And we had some wonderful facilitators who were more involved in what happened in Oregon in terms of politics, and they were able kind of to share some very big wins for Oregon, like, hey, but this happened and this happened. So kind of taking something that was really, really hard for a lot of people in our community and then talking about some good things that came from that. And some people that did say, well, this is the first year I signed up to vote because of everything that's happened. And other people that, for me, was, we had a member that stood up and he said, I knew this was going to happen. This is my reality. This is what I live every day. I don't know why everybody's so surprised. Like, I knew this was going to happen. But just offering the positives, always finding there's always something positive in whatever polarization is going on. So looking for that and asking people.
If I could just speak to that question, because I'm actually in the middle of that right now. I don't know where you work, but like you heard the term redesign. So, right, so anybody that hears that term, that means that you're not going to be doing what you're doing with the people any longer, right? And right, so United Way, I'm with Metro United Way, we're funders, right? They're not in the business of direct contact, but we started doing this ages and stages thing the way we started doing it with community because nobody else was doing it, right? And we wanted it to be done. So now we're in this redesign phase where we're going to try to find a nonprofit to hand it off to, right? And so to your point, like what do you do when things are so, because in essence, I'll look at these advocates that have worked with me and say, you all no longer work for Metro United Way. And so what do you do? So leadership development, right? So leadership development in all of the spaces that these advocates accompany me, it's always how do they get the most out of this? How do they build relationships so that they have additional opportunities? If a nonprofit picks up this ages and stages work, or I'll say when, the goal would be leveraging that relationship with that nonprofit so those leaders roll in and continue the work. But the nonprofit could possibly say, "No, we got our own people. We'll do it." Right? And so that's a tough thing that I'm in right this moment. So I appreciate the question because that's the nature of the work, right? It's that constant shifting of the tides. If it's not as large as an election, it's just local practicality and dollars and how they move around, or people just losing interest and lack of will. But leadership development creates sustainability. So however it pans out, if this nonprofit doesn't say that these folks are leaders, right? They have built their capacity. They can go and find and do and breathe and navigate and speak up and advocate for their community without us. Like that's sustainability. They don't need us, right?
So, Phyllis Meadows from the Kresge Foundation, and I think you kind of partially answered, really pretty much answered the question I was going to ask. And it was really around the challenges of turnover. And so I was just reflecting on that, not so much from the community. I know a lot of communities I've worked with, people kind of stay because they have to. But I was thinking more about the turnover of interest, where people come in, there's new players who are excited about a new issue, and they sort of come in. Maybe it speaks to the hope fatigue that we were talking about earlier, but I would really love your collective wisdom about, I get the leadership as a sustainability strategy, which I think is important, but I think there's another dynamic that happens in communities, particularly communities that have challenges. And I would love your thinking about this whole notion of turnover and maybe what we can do to, beyond the leadership piece, to really support communities so that they don't give up. Because I know there are communities that say, okay, here's a new one. There's money on the table, so we don't want to not take it because it's money. But in fact, they really are not, they may feel as cynical as I do sometimes about now we're regrouping for the next set of funding. So there's a different frame of turnover that I just think we're missing, and we're really being brutal to communities by doing it.
Yes, and I would say that in my line of work, which is nonprofit world, a lot of our funding is always changing. They're 3-year grants at most, at least from my experience. And so then the project changes, and our ED and our grant writers are looking for grants that are similar so that we can continue the work, but the deliverables and everything are different. And so, you build all this momentum, and it's taken, so we're at year 3 with the coalition that I'm at, and finally we're getting all this recognition, and people are coming to us, and they're like, oh my gosh, where's your Latinos en Acción group, which is our Latinos in Action group? We've heard that they went to city council, they testified in Spanish, la 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 la, and our fundings, so I think it's a part of all the funders. It's a responsibility of our funders to offer funding that's more long-term and more sustainable and more, I was at a conference in the beginning of the year where they were talking about Boeing. They had 10 years to just plan. 10 years, funding for just 10 years. If we could do that with our communities, I can guarantee you there would be a lot of cost savings in healthcare. So much if the investment was going to long-term funding, and also paying. I think a lot of times what happens too with leadership is that there's a high turnover with leadership because they, most of the time they're the masters and the PhDs that are able to go and pick up another job that's paying them more. And so also looking at how much staff gets paid within the workspaces too, and offering good benefits and pay.
One other thing to add, so again, our community is based in North St. Louis County. I don't know if anybody here has heard of Ferguson, but it is actually located right next door to 24-1. So we saw a lot of money coming in and leaving, and we don't even know how a lot of that money was spent. In some cases, areas like 24-1 were targeted from some of this more regional funding because they kind of see this as, okay, like, this is somewhere that I want to fix. At the same time, there's also money that passed 24-1 because even though it had a lot of, I guess, both similar challenges and opportunities to places like Ferguson, the name wasn't Ferguson. So we definitely saw a lot of very interesting financial funding turnover and coming in and out. And I think one thing that's really important is, I guess to Shelton's point earlier, is the importance of really having resident leaders. So for example, that knowledge, when we're talking about staff turnover, for example, there's a lot of residents that have been a part of the 24/1 community plan from the very beginning. So they actually have more knowledge than some of the staff that are working there. And so I think making sure that these volunteers are both recognized, but are also just really charged with being leaders in a lot of this work. I think that's really helpful. And then the other thing in terms of this kind of funding is not always going after it, which is really hard as an organization. But we sometimes see these really giant and amazing looking opportunities, but it's maybe 2 years, a lot of money, and then you're expected for it to be sustainable within the 2 years. And again, a lot of it is based off a lot of national attention towards the St. Louis region and kind of this fix-it mentality. So I think sometimes you just have to say no, even though it looks like a really amazing opportunity, but knowing that in the long run, it's not necessarily going to bring the community any further.
And I think this might be our last 2 questions.
So, can you hear me? Is this on? So, this is the roundtable on population health improvement, and one of the conversations we have with some frequency is to what extent the idea of health as a framer is a galvanizer of community organization. And so I wondered if people at the table could talk about whether you get people in the room by saying, let's make your health better, or whether the strategy is very different than that.
For us, we've simply just the way when we recruited community members was, do you want your community to be a better place? We didn't really talk about health and what it means. And then after we went into defining social determinants of health and how health is not just going to the doctor, right? But having something, I think it's hard sometimes to identify something that everybody will feel like they want to be a part of it. But I think when you talk about, do you want to make your community a better place? Most people want to be a part of that.
I agree with that, and I think that's also a really great opportunity to get youth involved as well when it's something a little bit more broad, so we get some of our best ideas from some of our youth, whether it's through community planning or other ideas. And in general, like you, we also have a focus on not necessarily bringing health into the conversation from the very beginning, but again, looking at more broadly, what do we want to do in the community? And then, for example, we've been doing a lot of this community planning work since, say, 2010 or so. And now is when we're really having more focused ideas on healthcare, because again, that wasn't necessarily the priority because there were all these other things that we wanted to work on first.
I really like that question a lot because I like how Robert Wood Johnson and various other folks are framing health in the broadest term, right? And I think that the community gets it a lot smoother than maybe the practitioners and the academics and the executives, like, because I think they start to be more exclusive to what doesn't fall in the framework of health, meaning like maybe incarceration. Well, that's another issue, right? So I wonder if it's the other way, and not so much that the community doesn't get that health is housing, health is economics, right? And when you're in the community, you might not use those terms, right? But everybody wants better, right? Everybody wants better for their family. They want better for their neighbors. They want better for their community, and that's health, right?
So just quickly, and it's kind of a comment and a question, so if there's no time for the answer, it's okay. But there was, you've mentioned about the importance of short-term gains, long-term gains, strategies that go towards those. And there was a question about sustainability, sustaining the energy, sustaining the changes that are achieved. And we talked about like community level actions, and then talked more about advocacy around policy change with elected officials. And there's also policy change within the institutions that are part of these local systems. And the fact that this work is dependent upon grant funding relies on a policy change in the institution that could have permanent staff in their operating budget, as one example. And so I'm just wondering if any of your advocacy efforts have addressed policy change within the institutions that lend to sustaining the changes that you've achieved beyond just the elected officials' advocacy with them.
So yes, so an example is we had a high disproportionate amount of children going into the foster care system. And a strategy that we used came from out of New York, where a mother who had had her children removed started working from the ground up in the system until she reunified with her children. And then she took what she learned and started helping other families to reunify with their children. So we brought that model in and piloted it, and she came and showed us. And over time, it became a full-time job through our Department of Community-Based Services, in which they hired mothers, fathers who had had engagement with the Child Protective Services, had their children removed, had then reunified. They would walk hand in hand with families that had that shared experience and help those families to navigate a case plan that was laid out by their Child Protective Service officer. And that job, 6, 7, 10 years later, is still heavily embedded. And so I think that answered kind of your question. Okay.
So we're at time now. And I want to thank our panel. Great presentation.